This podcast will focus on the examination of muscle tone. Throughout the PowerPoint and podcast, you will be provided with some talking points pertaining to tone, so the logistics of how you perform the test. And then you'll go on to see video clips of both adult and pediatric muscle tone assessments of the upper extremity as well as the lower extremity. You'll see a couple different developmental positions used throughout the test. When you perform an examination of muscle tone, what you're really looking at is that specific muscle's response to stretch. That stretch can come passively, so the patient moving the therapist's limb, or the stretch might be when the patient is actively moving. You'll check both of these in your tone assessment. But what you're looking to see and feel and palpate with your hand is the muscle's resistance to that movement. When you test tone, you are going to select a developmental position that has functional relevance for that patient. You're going to begin in a lower level position, such as supine or sitting, depending on the muscles that you wish to test. And once that testing position is completed and you've gone through the entire process, you will repeat that whole process again in a higher level developmental position. So if you did a seated assessment of tone, then you may take the patient to standing if that's functionally relevant for that patient. The reason you test in two different developmental positions is because you would expect tone to increase as that patient is working up against gravity. And you'd want to see what is the functional bearing of that on function. Another piece to keep in mind when looking at muscle tone is that you want your patient to remain quiet during the testing. And the reason for that is that when patients have increased tone or spasticity, any sort of active movement or vocalization will likely automatically increase their tonal base. So just the same as position change would increase tone, any form of verbal communication or expression or active engagement will also likely increase that patient's tone. So you'll ask your patient to remain quiet during the testing so that you can get an accurate assessment. Once you've selected the position you'd like to work in, you have to make sure that the patient is properly positioned so that they can move through their full available range. So, for example, if the patient's in supine, you may have to have them close to the edge of the mat so that their arm has clearance for shoulder flexion and extension. From there, you want to place your hand on the muscle belly that you're going to test, because really what you're looking to test is the resistance to your movement and to the patient's own active movement. So you have to palpate that to be able to feel that resistance at times. So you want to palpate on the skin over the muscle belly in which you're testing. Next, you'll begin the test and you'll move the patient through their full available range from the shortened position for the muscle that you're testing to the lengthened position. The reason we go from the short muscle position to the long is that we would expect tone to increase as that muscle lengthens, because that's where you will feel the resistance to that relative stretch. So you'll start in the shortened position and move to the lengthened position. You'll test the full range first, and then you'll vary the full range into slow, medium, and faster speeds. From there, you're going to break the range down into thirds. So you could think of that as the beginning range, the middle of that range, and the end of that range. And you'll test only in those ranges. So you'll go to the beginning range, start in the shortened position, move through that first third of the range. And then you will also vary the speeds within that range. So you'll do slow, medium, and fast throughout that first range. Then you'll go to the middle range of the motion and you'll do slow, medium, fast, and then repeat that for the end of the motion. Once you've completed the process passively, you need to repeat that entire process actively. So you will provide the patient with instructions for them to move through their full available range from the shortened to the lengthened position. And then again, just as you did passively, you're going to have the patient actively move through the beginning range, the middle range, and the end range. And in each of those range brackets, you need to vary the speeds: slow, medium, and slow. Same process that you completed when you were passively moving the patient's limb. Keep in mind that if this is a two-joint muscle group, such as elbow flexors, you need to repeat the process with the joint change. So you'll see in the video, elbow flexion tone is tested with the shoulder in neutral and the shoulder in 90 degrees. You would have to complete the entire process passively and actively in that different position if the muscle you're testing is a two-joint muscle.
Okay, Lisa, so for this next test, we are going to take a look at the muscle tone of this muscle in your upper arm right here. And basically, what tone is your body's resistance to stretch. So your muscle will be put on stretch when either I or you move it in different positions. And everybody's muscle will respond differently to that resistance to stretch. So I'm going to take a look at that with you because you had told me in your history that sometimes when you're putting your arm through your sleeve that you feel like that you're stiff up here, and that's limiting you from fully getting your elbow straight into the sleeve as you're getting dressed. So I want to take a look at the tone of that particular muscle group to see if that might be playing into your difficulty with that task.
Okay.
What this test involves is me putting my hand on the muscle that I'm testing. So I'm going to have my hand right here on this muscle, which is called the biceps. And I'm going to first just be moving you through a variety of motions here at your elbow, okay? At this point, there's nothing for you to do. You can just sit there and allow the movement to occur. We're going to be quiet during this test because sometimes what can happen is talking or any type of volitional movement will increase that tone base, and I want to get a clean assessment of what your resting tone is when I move you, okay? When I'm done with that part, I'm going to give you some further instructions because then you're going to complete the movement, but I'll give you that instruction as we get there. Okay. Do you have any questions before we begin?
No.
Is it okay if we proceed?
Mm-hmm.
Okay, so what I'm going to do is just scoot to the side of you so I can access your arm a bit better. And what we're going to do is I'm going to start with your arm down here. I'm going to put my hand here, and all you have to do is sit there and relax, okay? Before we begin, can you just sit up nice and tall so we'll make sure you're in your best seated position? Good. Are you comfortable?
Mm-hmm.
Okay. Okay. Okay, go ahead and take a quick break. How are you feeling?
Okay.
Okay. So as I was doing the assessment of your tone, you may have noticed that I kind of was checking ranges of your tone. So I had a very shortened range, kind of a middle range, and then what we would consider an end range where your muscle is long, okay? So now it's your turn to do this actively. So we're going to move through the full range of motion, okay? And then we're going to break it up into those ranges, and I'll give you some instruction pertaining to that as we get to that piece.
Okay.
Do you have any questions before we begin? Okay, so just place your arm back. Okay. Okay, Lisa, so go ahead and have your arms straight, and And what you're going to do is move through the full range of motion. So you're going to go from, you're just going to bring your arm up, and then you're going to straighten your arm out. We're going to repeat that a few times at this speed. Okay, now do this a little bit faster. And a little bit faster. Good. Okay. Any problems with that? Okay. So now the next piece is we're going to break it down into those ranges. So however you want to think about that. This is your beginning range, the middle of your range, and the end of your range. Okay? So you're going to start with your arm bent, and then you'll move it to approximately right here and back. Okay? So it's this beginning range I want you to do. And a little faster. And a little bit faster. Good. Okay, how you feel?
Okay.
Okay. You know, I think we're going to repeat that because your arm got a little bit ahead of where I wanted it. So let's bring the arm back because it really has to be in line with your trunk here. So we'll start here and go just to about right here. Good. And a little faster. And a little faster. Great. Okay. And now we'll do from about here to about here. So starting here, ending here. Okay? Slow it first. And a little faster. And a little faster. Great. Okay, so now we'll do the end of third of the range of motion. So you'll go from about here to straight, and not quite at that 90 degree, but maybe about here to here. Okay? So we'll start here and go ahead slowly. And a little faster. And a little bit faster. Okay, good. And go ahead and rest. You feeling okay?
Mm-hmm.
Okay. So now, because of where this muscle is and it crosses more than one joint, it's a 2-joint muscle, I need to change the position of your shoulder and repeat the same process, okay? So there's nothing for you to do right away, but we're going to keep your arm here, okay, at 90 degrees, and I'm going to repeat that same process here, okay? So we're going to start here, and all for you to do is to relax. Okay. You doing okay? Okay. So now, for this part, you'll actively repeat that process. And what I'll do is, I'm going to just give you some cues here to help you keep your arm up a bit, because I'm not so much looking at the strength as I am your muscle's resistance and its response to you moving your limb, okay? So we're going to start here, and you're going to straighten your arm, nice and slow the first few times. Okay, and a little quicker. Okay, good. Go ahead and stop. Let's take a quick break. That was good. So now we'll do where we break it up into thirds, the same process we did as before. So about from here to here will be that first range of motion, and then the middle range, and then the end range. Okay? And when you're at that end range, really be mindful that you're getting your arm as straight as you're able to. Okay? So let's come back up to that position. And you're going to start all the way closed like that. So the first third of the motion would be about here. So from here to here, okay? All right, you go ahead, slowly. And a little faster. And a little bit faster. Okay, great. That middle third is about from here to here, okay? So you're going to begin here. Go ahead. And a little faster. And a little faster. Great. And then the end of your range. So about from here to completely straight and back, okay?
Okay.
Slowly. And a little faster. And a little faster. Okay, good. Okay. Okay, hi Nolan, I'm Miss Jen. I'm your physical therapist today, and what we're going to do is take a look at your muscles and how they move. So your muscle is like a rubber band here. So if you pretend this is your muscle, it has stretch. So the muscles stretch just like this rubber band. So I'm going to check to see how much your muscles stretch when I move your muscle and then when you move your muscle. Okay? What I have to do for this test, you're going to be laying down, and I'm going to put my hand right here on your arm. I'll roll your shirt up. I'm going to put my hand right here, and I'm going to move your arm around at first, and you don't have to do anything for that, okay? And then I'll give you directions when it's time for you to do the movement. Is that okay?
Okay.
Okay. For this test, we're going to be really quiet because sometimes when kids talk, it makes their muscles not be able to stretch as much. So we're going to just be quiet so we can get a pretty accurate test here for your muscle tone, okay?
Okay.
Is it okay if we do this test?
Yep.
Okay, can you lay down and put your head on the pillow? Good. Are you nice and comfy?
Yeah.
Okay, so you just get to relax. I'm going to scoot around over here. I'm going to take my shoes off for the mat, and I'm going to come on up over here. Okay, so what I'm going to do here is I'm just going to roll this sleeve out of the way so nothing else is touching your skin. All right, move your legs here. Okay, and so you just get to relax right now. So what I'm going to do is I'm going to put my hand here to feel this muscle. Okay, see how you have a muscle right here? And I'm just going to move your arm up and down. We're going to start up here in the short position, and we're going to come down. So you just relax. Good. Now I'm going to do little tiny ranges. So I'm just going to move you from here to here. So you relax. A little faster and a little faster. Now I'm going to go from here to here. A little faster and a little faster. Now this last part of the range from here to here. I'm just going to change my grip on you. You relax. And a little faster. Good. Okay. Now it's your turn, okay? What I want you to, you can stay right where you are. I'm going to take my hand off you, and what I want you to do is to go from here, straighten your arm all the way out. And bring it back up. Good. Keep going. And put this just so it comes down to your side and back up, just like that. Perfect. Good, and a little faster. bit faster. Good, Nolan. Okay. Now for this one, you're just going to come from here to here. I'll put my hand here so you know where to stop. So start there and go until you hit my hand. Good. And a little faster. And a little faster. Perfect. Now we're going to start here. You're going to go to about, so you're going to start here and go to where my hand is. Nice and slow. And then a little faster. And a little faster. Perfect. Now we're going to go from here to the end of the mat. Okay, start slow. Oops, right here, sweetie. From here to here. So just that very last bit. Perfect. And a little faster. And a little faster. Good job. Okay, how was that?
Good.
Doing okay?
Yep.
Do you need a break?
No.
Okay. Now we're going to keep this up because we're not done yet. Now what we're going to do is put your arm here, and we're going to do the exact same test, but we change the position of your shoulder, okay? So you go ahead and relax. And I'm going to start you down here. We're going to come up and back. So you just relax, Nolan. You know what, buddy? I'm going to move you to the edge of the mat for this because I'm not getting all the range I need here. So pick your head up. Okay, can you scoot so that you're right on the edge? Perfect. Okay. Okay, we're going to try this again. Start here. Come up. Good. You just relax. Okay. Now we're going to start here. I'm just going to do this first range. Okay, now we're going to do this middle range. You just relax, kiddo. This end range. Good. Okay. Now, take a quick break. Now you're going to do the exact same thing, okay? So when you're ready, you're going to bring your arm back up into this position, way up here, and you're going to start down here by my hand. And you're going to, here, let's fix your legs, put them nice and straight, and you're going to straighten your arm nice and slow. So start here, and then come up. Good, and back down. Good, faster. And a little faster. Okay, let's try it a little faster one more time, but keep your shoulder like glued right on the mat. Don't let it come up. All the way straight. Good boy. Okay, now we're going to start down here and only go to where you hit my hand. Good, slow. And a little faster. And faster. Good. Now we're going to go from here to here. So you start right here. Can you straighten your legs out, kiddo? Thank you. And then all the way up to my hand. Good. Hang on. One more time. From here to here. Okay? This is like baby ranges. Okay. Now from here to here. That, right like that. Good. Faster. And faster. Perfect. Now, this very last part. So from here to straight. Here to straight. Here. Start where my hand is and then make it straight. Make your arm straight. Good. And come back to my hand. Perfect. A little faster. From here to here. Good. And straighten your arm all the way up. Good. Okay. Good job. buddy. And we'll take a break.
Okay.
All right, Nolan, we're back again. We're going to do that same exact type of test that we did for your arm, but now we're going to do it on your leg, okay? And we're going to use this muscle right here on your leg. So remember our rubber band that we talked about before and how it stretches?
Yep.
We're going to check out how your rubber band right here, your muscle right here, stretches when I move your leg and then when you move your leg, okay?
Yep.
Does that sound all right?
Yep.
All right. So what this test involves is me putting my hand right on your skin. So I'm going to have to, once we lay down, I'm going to roll your shorts up and I'm going to have my hand here. And then you get to pretend like you're asleep. We're going to be real quiet like we were before, okay? And you can go ahead and lay down. The reason I'm doing this is because you and your mom were telling me that when you're in gym class, sometimes you have trouble kicking the ball, bringing your leg all the way forward to kick the ball. So we're going to check out how the stretchiness is in your leg, okay?
Okay.
I would have also provided Nolan with a functional rationale for his upper extremity for the bicep that we were testing, so I could have provided him with an explanation pertaining to reaching into his cubby at school or something that would require elongation of that bicep. All right, so are you nice and comfortable?
Yep.
All right, I'm going to scoot behind you. You stay right there. And I'm just going to get you lined up a little bit better. So you can bend this leg. And you know what? I'm going to give you this to hold on your side. This is like so you come onto your side with this arm. Hang on. Let's lay on your side first this way. Perfect. Okay. And then let me get you a little bit more lined up here. So we'll bring your head back a little bit. Okay. Let's see, a little bit more. Perfect. And then this leg is going to stay bent, and this leg is the one that's straight. Are you comfy?
Yep.
Comfy, cozy?
Yep.
Okay. All right, I'm going to roll these shorts up, kiddo, just like this.
That tickles.
It tickles? All right, I'll try not to too ticklish. Okay, so we're going to start with your leg straight. So you go ahead and you rest your leg. Very good. Okay, and then all you have to do is relax right now because I'm the one that's going to do the work here. So I'm going to take your leg and I'm going to bend it and straighten it. Good. And now I'm going to break this up into small ranges so you keep relaxing. Okay, and then this very last piece. Perfect. All right, I'm going to give you a little break. Now, when we start back up, it's your turn, okay? You're going to do the same thing I did, and I'm going to give you instructions throughout, okay? All right, so can you put your pretty blonde hair back here on this pillow, and you're going to stay on your side. There you go, perfect. Good listening. And we'll bend this bottom leg up so you don't have to worry about balancing. Okay, so what you're going to do, kiddo, is I'm just going to support your leg a little bit here, but you're going to do the movement. I want you to start straight, and then I want you to bend your leg slowly. Okay? Go ahead, you do it. Okay, we're going to stop for 1 second. I'm going to fix your body a little bit here. So just lay right on this hip. So put this right on the mat. That's perfect. All right, I'm just going to straighten you up a little bit here and move your head back a little bit. Perfect. Okay. So you're going to hold your leg up and go from here to here. Good, you do it. And faster. And all the way to your butt. So touch your heel. There you go. Good. All right, go ahead and relax. Okay, now we're going to break it up into little ranges like we did before, okay? So
Okay.
you go back on your side. Okay. We're going to have this leg bent, and we're going to start straight like this. And I just want you to go from here to here. You go ahead. Good. And faster. Okay, good. Let's relax for a second. I'm going to try I'm going to grab one more pillow, kiddo, okay? So you go ahead and lay back on your back. I'm going to try putting another pillow behind you because your bottom was scooching away from me. So I'm going to see if I can make it stay in one spot a little bit better, okay? Can you lay back on your side? Okay. All right, come this way.
Okay.
There we go. Okay, now bend this lower leg. Okay, let's try this again. So you're going to go from here to here. You do it all on your own. Perfect. That's much better. And I'm just supporting this lower leg as opposed to moving it. Now go from here to here. And then all the way, the last range, buddy, is from here to here. Hang on a second. Okay, go ahead now, do it. Faster. And faster. Perfect. Okay, you go ahead and rest. How was that?
Good.
Okay. Now we're going to do the exact same thing, but I'm going to change the position of your hip so that we're going to be here. So you bend this leg up again, and we're going to start here and go from here to here. Okay?
Okay.
I'm going to switch where I am, so you stay right where you are. I'm going to come in front of you. Hopefully I don't block the camera, so I'm not reaching over your body. Okay. So we're going to start all the way straight. You okay?
Yeah.
You just pretend you're asleep right now. Good. Okay, I'm going to give you a quick break. So his end range was not quite all the way to neutral. So this was his end range here. So that's as far as I went. Ready to keep going? Okay. All right. So I'm going to go from here to here. And I'm just going to have you come back here and just rest. Okay, we'll give you a quick break, and then you're going to do the exact same thing, okay?
Okay.
I'll explain it to you as we go. All right, so I'm going to support your leg right here, and what you're going to do is start as straight as you can, and then slowly bring it all the way back towards your bottom. So you do it. Perfect. Straighten it out as far as you can. Good boy. And back. Okay. Now go a little faster. And a little bit faster. Perfect. Okay, let's take a quick rest. That was our full range. Now we're going to break it up into those baby ranges, okay?
Okay.
And then you'll be all done with this. All right, so let's bend this leg like this so you're nice and comfy. We're going to start here, and I just want you to go until you feel my hand. And straighten it. Okay, and a little faster. And a little faster. Good. Okay, now you're going to start from here and go to about here. So from here to here. I'll put my hand there so you know where to stop. And a little faster. Good. Now you're going to go from here all the way back, nice and slow. And a little faster. you.